So what have I been doing about my health insurance since I've been here in the Philippines? This video is going to talk about basic the how they do health insurance here in the Philippines, how it's different than what the U.S. is, and also I'm going to explain the policy that I actually have, and the one I had last year, and the one I'm probably going to get this next year. So stay tuned. So forgive me for the sounds that are here, but I'm just letting the actual sounds in the Philippines going to be in this video. So I'm up on my rooftop at my house in Pabia, Iloilo, Philippines. And so let's get into my current insurance policy and tell you what it costs and what the benefits are best I can. Now, you have to pardon me because I'm going to be looking off to the side a little bit on my notes. Okay, here we go. This insurance policy I bought, actually, this is my second year that I've bought insurance here in the Philippines. Now, one thing you have to understand about Philippines health insurance, it's mostly an inpatient proposition. Any medical expenses that you have outside of the hospital, pretty much you're going to be able to handle, and you can get some, you can get some help for that, a little bit of help for that. But mostly, most of your charges that, or most of the benefits of an insurance policy here in the Philippines are just basically inpatient only. So let's get into it. My policy costs 278,272 pesos, which is about $4,700. So I spent almost $5,000 the year of 2024 on health insurance here in the Philippines. Now, some things have happened since then, and I'm going to change, and I'll let you know the reasons why I'm going to change this policy a little bit later. But here's the rundown. So it's about $4,700. The basic limits, the overall aggregate of the policy, what it can maximum it can pay you every peso is a half a million, or is 5 million pesos, which a million pesos is about $20,000. I just always round it that way. It's not exactly right. Actually, it's less than $20,000 now for a million pesos. But for the purposes of making it simple, that's what I'm going to do. So it's 5 million pesos. Now, if you go in the hospital, probably one of your major costs is going to be your room and board. And that's going to be a big portion or a big percentage of it. It depends, of course, on what kind of surgery you have, if you have surgery, So that room and board is very expensive. And room and board with this specific cross, it's called a peso policy because they pay in pesos and the limits are in pesos, is going to be paid as charged. So if you spend 10 days in the hospital, it's going to pay you whatever the fee is for 10 days as charged. An attending physician's visit, you have a daily limit of 4,000 pesos, which that's about $70, and that should cover about any attending doctor's charge or physician's charge that you're gonna experience here. I pay about 800 pesos when I go see my cardiologist. I've seen him twice. That's what he's charged me both times. So the doctor's fees are not terribly high. Okay, a specialist fee, you get a specialist fee benefit. It's a daily limit of 4,000 pesos per day, which is I'm gonna guess around $80. Okay, and you can pretty much get a specialist for that. I've paid a specialist, gastrointestinal doctor, whatever they call it, one time here. To give you an idea, it's at a nice hospital here, QualiMed, here in Iloilo City, and the fee was like 700 or 800 pesos. So a daily limit of 4,000 is very generous on this policy, and it's going to take care of that. Also, they have a private duty nurse that you can use at home after you leave the hospital for up to 5 days, and that limit, it has to be authorized by an attending physician. He's going to have to prescribe that to you, but for up to 5 days immediately after hospitalization, to get you kind of back on your feet, get you really super stable, you're going to have this benefit of 3,600 pesos, which is about $60, and I would say that's pretty much going to take care of your 5 days. the costs here of medical procedures, of doctor visits, of private nursing, and things like this are so super cheap. A lot of times I run into it, it's like 1/10. Now I'm not promising it's all 1/10 of the price that you pay in the United States, but I'm saying I've had it a lot of times and I figure it in my head because I know my own prices, and you know, it's about 1/10 most of the time. Now, not all the time, but most of the time. For example, I have labs done, and in the U.S., I think it was my last lab done was like $278. Well, for about $27, you can get the same lab test, just as good a lab test here as you get in the U.S. for about $27. And these are all averages, and the prices fluctuate due to whatever inflation. But it's going to be usually, and not all the time, but about 1/10 what you're going to pay. So these labs, these doctor visits, I've been to 3 doctor visits since I've been back. They're all 500 pesos a piece. I go buy my medication, which is really pretty cheap here and very reasonable. And I'm able to pay all that out of pocket because I don't have a big, huge expensive medical plan, but the the hospitalization, medical insurance, health insurance plans here are not going to cover these things out of the hospital very often. Okay, intensive care, like a coronary unit, maximum 10 days per year, it's just going to be paid as charged. So you're not really going to have any out of pocket for that. Medical implant due to accident. I thought I'm not going to include this because I'm not but it could be anything. It could be a pacemaker. It could be some sort of thing. If you broke your arm, they're going to have to implant something, or who knows, if you have appendicitis and they have to put some, I don't know, you go down in the comments, you might give me some examples. I've never had anything implanted in my body except a stent, and so these are due to accident though. They cover most implantable devices necessary for a surgical procedure is the actual wordage. Okay, let's see, give me just 1 second. And the maximum on that is 25,000 for the implant. And let's see, these are injuries that are as a result of an accident, and that's what they're talking about here. They're not talking about any kind of surgery that you go into, but due to an accident, that's what this is for. It's 25,000 limit per year, or right around $500. So what I found is these kind of charges are very commensurate to what they're charging. It may be cheaper here in Iloilo, it may be a little more expensive in Manila, but these are real world figures, and this is what I paid. I paid $4,700 for this health insurance. So there's a lot of little things, and I'm not going to get into all of them. Surgical benefits, basically it looks like their surgical benefits and their surgeon's fees are going to be based on an overall average of the market within the Philippines, and they're going to pay basically what the market is paying. Now, if you get a surgeon and he's just really expensive for some reason, we don't know why, it's going to pay the average. And it's kind of similar in American health insurance the same way. So payment of professional fees, these things are just going to be on what they call a PhilHealth relative value scale, and what they should charge. So, and they should all be in an accredited network. Okay, I'm going to go through that because there's so much wording in that. I don't understand a lot of it, and it doesn't really come across on video. If you have specific questions, you can always contact Michael Onstad on Facebook. Super easy to get a hold of, super personable guy. If you've watched the videos before on my health insurance stuff, that's who I use. He's got a call her an executive partner, executive assistant, whatever, Miles Lava. She's Johnny on the spot when it comes to customer service and being able to explain these things to you. That's the biggest thing. And that's the biggest benefit I've had so far with Pacific Cross. I don't know, I haven't compared all the insurances in the Philippines. Some people say, well, this Cigna is the best one ever, and this one, to me it's like car insurance in America. You can get American Family, you can get Farm Bureau, you can get, what do I have? Progressive, you can get all, they're not going to be too much different. You're not going to save tons of money by going from one to the other. But to me, the difference is the trust in the person that you buy it from, and that trust is earned during the customer service process. And that's where I really believe, not just Pacific Cross in general, but Michael Onstead and his assistant there, executive assistant Miles Lava, the customer service it's so much better, I'm sure, than experiencing all the customer service in the Philippines. These guys, I'm telling you, they're very fantastic. So I would recommend them. I don't get paid for this, but I'm just telling you my personal experience. So emergency outpatient treatment for a covered emergency treatment not leading to confinement or not going to the hospital, provided by an outpatient department of a hospital or licensed doctor in his clinic, is a maximum amount of 8,000 pesos per year, which that's not a huge benefit. Most of us can just take that out of our pocket. 10,000 would be like $200. So it's a little over $500, $600, $700. It's a benefit. If you're paying the policy, I'm going to squeeze every bit of peso out of that sponge that I can get. So yeah. Also, it does have an accidental death of 75,000 pesos on this policy, and that is about $1,200. That pays a good part of a funeral. Doesn't pay the whole funeral here, because I paid for one, but it does help, and it's going to help those left behind. So my policy is $4,700 US, basically for the following reasons. I've got some pre-existing conditions. So insurance companies do, if they're going to cover you on a pre-existing condition, they're going to load up the premium on that policy to make sure, that they can afford people like me. Now, if you're in great health, I'd say your policy, you can't hold me to this, but I would think it's going to be maybe a little more than half this price, or maybe less than half, somewhere in there. Again, talk to the office of Pacific Cross, Michael Onstead, and he can give you those prices. And they'll just be free to give you any kind of rates that you want to get. But my pre-existing conditions are, I've had a stent put in my right side of my carotid artery. I've had this one cleaned out, so it's not going to cover it. It does cover that in 2024. I've got like 1 or 2, 3, 4 days left of coverage on that, and that did cost a significant amount, and that's included in the $4,700. Also, carotid artery disease is not going to cover. It has covered this year, but if I take that out, it's not going to cover it. The first time I didn't have it, my policy was a lot less. I also have high blood pressure, which I'm working on. I've lost 10 pounds since I've been here, cut back on a lot of stuff. And one reason I'm going to go, what I'm going to do is actually take these pre-existing conditions back out of my policy so that I feel like it's going to be a lot more affordable. We'll see. I will let you know. But I'm going to try to down the cost of my insurance this year, because, $5,000 is a lot of money when you're retired. I can do it, but I didn't use it last year, and here's the main reason why. I'm actually healthier now, probably than I was back in 2017 when I started having these situations. I weigh less. I've dropped 10 pounds since I've been here, from 220 pounds down to 210. I'm getting myself in better physical shape. And also, the main thing is I had a lot of tests this year, which were super cheap as far as anything compared to America. And so what I did is I went in and I just ordered these tests on myself through my physician. And you go and you get a 500 peso doctor's visit, and you say, hey, I want these tests because of this reason, and she'll pretty much write those prescriptions for those, and you take them to a clinic or a hospital, wherever they're going to do the tests. And shoot, I bet I didn't spend $250 this year on tests. So, and that was including an echocardiogram. There was 4 nurses involved, and it was a very good test, and a visit to a cardiologist after that, and it didn't cost me much over $200. So yes, I do have I've been told that I have gallstones. So I had a full checkup in Bangkok, Thailand, about 2 or 3 years ago, and they said I had gallstones. So that's on the list too. If I have gallstone surgery here, it's not going to pay for it. Pacific Cross is not going to pay for it. But this next year, it would have happened this year. But the cost of a gallstone surgery, take out your gallbladder, I would say 2,500 and down, $2,500 US, you could probably do it. Now, I haven't researched that lately. Go down in the comments, you think I'm wrong. I'm wrong a lot. So this is not a medical advice, and everything you hear, you better research it on yourself, But I'm trying to give the guys that maybe don't live here or don't know that much about insurance kind of bird's eye view of what you can expect and what they offer. Now, they're not hard and fast facts. I'm not giving advice or medical advice in this video, but I'm just trying to give you a feel for what it's going to cost. So anyway, those things were taken off. My pre-existing were taken off, and so that's it on my policy. And again, next year, and I'm in kind of negotiations process. It's December. I got to get my health insurance lined up by the 26th of January for next year. But I think I'm going to do a cutback. One reason, I was actually watching Paul, Old Dog New Tricks. If you watch any videos in the Philippines about retiring in the Philippines, he's always going to be on there. I don't watch him much. He, to me, is like, one of the godfathers of the YouTubers in the Philippines. But, I know a lot of stuff that he knows. He's a great storyteller. He does a different thing than I do. But all my props to him. But here's one thing I really took away from what Paul said about what he does. Now, he basically just keeps an emergency fund, and I would suggest $12,000 to $20,000 at least. And if you agree with that, give me a thumbs up. If you disagree with it, write the comment why. I can be wrong, and I'm just feeling my way through this whole Philippine expat thing, just like you may be in the beginning process of it, or you may be in the middle of it like me. You may have some answers I don't, but he basically said he has a savings account, emergency fund for hospital care, stuff like that. And what he's going to do, and he's over 65, he's going to get patched up here, and he's got enough money to fly himself to the U.S. and be treated in the United States. That's the way he deals with his health insurance. And after age 65, I really think that's what I'm going to do. So, but I retired at 59 and a half, and I had medical problems. So I want to make sure the savings that I have set back for retirement that I'm not even using yet, my IRA and stuff like that, and my real estate, I'm not trying to touch any of that stuff until I reach about, I think it's 67 years old, because I've got some income through the sale of business that's going to drop off at that time. And I really need to have savings in place and that income in place, and I don't want to squander that if I have some serious medical conditions here in the Philippines. So I set the insurance up as a fee per year up until I'm 65, and I'm going to go to the old dog new tricks plan probably when I get qualified for Medicare. So right now I do have the Affordable Care Act in the United States, and that's a whole nother video, but I don't pay a dime. My deductible's really high, but I don't pay any out-of-pocket expenses. The maximum I can pay is like $9,700. If I go in for a heart attack, or I've got to go in and have valve replacement or something like that, which my heart's in great shape. I found that out of my stress echo. But things like this can devastate your savings here in the Philippines, even though it's cheaper than in the U.S. If I can get myself stabilized here, they got good doctors here, and then I can fly to the U.S., I can get maybe more traditional, or maybe feel a little bit more comfortable about having a more serious operation there because I got coverage there. And then of course when I turn 65, I'll be on Medicare, and then I won't even have to worry about that Affordable Care Act health insurance that I've got right now. So, as you get older in the Philippines, the price of this policy is going to get higher and higher and higher. They don't have Medicare here, and Medicare doesn't pay here. So that's the reason I'm doing what I'm doing. So if you have any questions, go down in the comment section. You can ask me, and I'll try to help you best I can. The best research you can do is research on your own, because here's why I say this, because you're in your own unique situation. And so there you go. My situation is different. Maybe I can afford more costs than you can, or maybe you can afford all the costs and you don't need the insurance at all. It can go, it's like asking, and I've never done a video on how much it costs to live in the Philippines, because it just varies on each person. So anyway, that's my video. I've been about 20 something minutes into this, and I'm gonna let you go. And I will do another video when I do my negotiation. It's going to be probably at the end of January, and then I can tell you what happened there, and I'll tell you the cost of my insurance. So if you like this video, like and share, subscribe, all the good stuff. And I appreciate everybody for watching. And I'm just amazed at the people that comment. What I'm really amazed is the shares. I got a lot of shares. I don't share many YouTube videos. I don't know, maybe I should. I should be a better YouTube watcher. So, you know, if you haven't commented in a while, go down in the comments, say hi, whatever you want, tell me where you're from, and we'll get together on the next video. Thanks for watching.